are the future.
We are the future. We are the dream. We are the nation. We are part of this. Yes, we are so amazing. That's the least we shall be. At the heart of the nation, changing history. How can they say that we are finished? We have just begun. When we have nowhere else to run to, we have nowhere else to go. So get out of the way of the land of our dreams. We are the nation, we are part of this. Oh, oh. We are the nation, we are part of this. Whoa.
Nigeria has made limited progress in the health sector over the last 2 decades, with 900,000 children and mothers dying every year. In an effort to change the narrative and address the maternal and infant mortality and morbidity in the country, a program saving 1 million lives was initiated by the federal government in 2012.
Saving 1 million life program for results is a World Bank project initiated by the federal government, which gained fundings from the World Bank. It's a performance-based program aimed at improving maternal, newborn, and child health indices in Nasarawa State, particularly in terms of the quality and quantity of some indicators of maternal, newborn, and child health.
Saving 1 million lives is a program for results project for Nigeria aimed at increasing the utilization and quality of high-impact reproductive child health and nutrition intervention. Saving 1 million lives is supported by the Performance for Results (P4R) operations to ensure greatness and focus on results, increase accountability, improve measurement, strengthen management, as well as to encourage innovation. In 2012, the federal government of Nigeria initiated Saving 1 Million Lives program in 13 states, and in 2015, it was branded as SOML Program for Results and was scaled up to the remaining 23 states, including the FCT. To give the program impetus, the World Bank approved $500 million credit to the Federal Ministry of Health, with each of the 36 states and the FCT receiving $1.5 million for onward implementation. SOML is therefore an initiative with 6 thematic areas or health pillars to include immunization, malaria control, nutrition, prevention of mother-to-child transmission of HIV and AIDS, delivery of essential drugs to address common childhood illnesses, as well as to strengthen maternal and child health delivery platforms. There is no doubt SOML has come to respond to the poor health care in the country, particularly for mothers and children, following reports that an estimated 1 million women and children die yearly, largely from preventable causes. With the coming of SOML program into Nasarawa State after bidding for the contracts in the state, upliftment and upgrading of healthcare facilities had since commenced with a view to improving the quality of healthcare service delivery across the state.
We have some reasons for considering that. Number one, the program is after qualitative service delivery, which is one of its objectives. Now, if you talk about quality and you discover that when a client goes to health facility and discover that everywhere is not in good shape, they would not want to come back the next time. And of course, you are already missing the client. And then again, on the side of the health workers too, having a conducive atmosphere to enable them deliver their job effectively is very, very key. And so the program discovered that some of these health facilities were actually not in good shape to encourage the healthcare workers to deliver their services well, and also to encourage the clients that would come to go and come back the next time they require such services. And that is why we have to consider based on the lean resources we have to renovate some of the health facilities in the state to bring them to standard in line with the state government agenda. We sincerely thank the past and the present administration for giving us their full support in terms of giving us the go-ahead to implement most of our programs. And they did not just stop at that, they have to follow it to the logical conclusion. So it is that will that the present governor, as Engineer A.A. Sule, has gone to Kurmi Shinkafa and then had a working visit there to see whether there are value for money or not, and he actually saw that yes, the program have done well. And General Hospital Kefi, the extension of the maternity ward and administrative buildings, or let me say offices.
Let me really thank the federal government as well as the intervention fund for taking care of this particular village. This particular locality is extremely close to me because it is the first village you will enter from my own hometown of Gudi into Kokona local government. And so this I consider a project really for me. I'm the one to thank all those who have made it possible, all those who have worked so hard to establish this particular project.
The program, in collaboration with the state government and the stakeholders under health, we're able to renovate about 81 sites. 81 sites that of primary healthcare we're able to renovate and then construct, because it doesn't stop at the level of renovation alone. About 67 primary healthcare were renovated. Among the 67, 5 or 6 of this primary healthcare were newly built by the program, such as Kurmi Shinkafa, primary healthcare Kurmi Shinkafa, primary healthcare Odenyi, in primary healthcare Ngache in Nakwanga local government, others. And then the renovation of 11 general hospitals were also included. Then we have 2 service delivery areas of Dalhatu Ara Specialist Hospital, Lafia, and then the Central Medical Stores. Lafia was also renovated or upgraded to pharma grade.
SOML has done a lot for the Dalhatu Ara Specialist Hospital in Lafia. Based on the thematic areas of SOML, one of them is child health, and we have a lot of interventions in the hospital in terms of infrastructure, in terms of equipment, to deal with the issue of child and maternal health, which is the whole essence of the intervention of the SOML. For example, we have a primary health center that is being midwifed by Dalhatu Ara Specialist Hospital, and that hospital has gone a complete renovation by the SOML in terms of the infrastructure present in that place, in terms of equipment, in terms of expansion, in terms of making the place more conducive for women and children to be attended to. Again, within the hospital itself, our immunization unit has also benefited from the SOML intervention. The clinics have been renovated, they have been upgraded, and they have been made more conducive. Appropriate equipment have been provided. We also have the section that deals with infections and also related to eyes for children, especially. Those ones has also been renovated and upgraded. We have also intervention in the O&G department, which deals with antenatal care, skilled parts delivery in the hospital. And I think that is even where we had the highest intervention from SOML: provision of equipment, upgrading of the antenatal clinic, and our means of follow-up with the patients has also been impacted positively by SOML. So we have a number of interventions like that, and we are looking forward to getting more intervention from SOML in the areas related to their thematic areas as it relates to child and maternal health in Dash.
The Save 1 Million Life program is a World Bank program supported and taken by the federal government and given to state as grant. But it's a performance-based program. As much as you do, the indices for statistics for your performance are very clear, and you can aim relatively to your performance. It struck us when they started this about 3 years ago, or around about 3 years and for about months, almost 4 years ago. This Save 1 Million Life is purely to improve the child and mother's health in the entire nations, in which I did mention that the status and indices of measuring health status are under 1 morbidity mortality, under 5 and maternal mortality, morbidity and mortality. Clearly, some of the facilities have been transformed beyond the expectations. The OIC and the community people will tell you better as you visit the facility and ask them, what do you feel and how is the touch of the impact of programs and effect of what has done? The story are very clear. For a true testimony coming from the community for their impact and happiness, never before have they ever for quite a long government that their facility has been touched in this nature. And more so, they will see beyond the touch of facility to the services and the presence of personnel that will take good care of them. I can assure you, our team of inspectors of 3 categories, first exposure, second exposure, and the final exposures are all on team, and where corrective measures are necessary, we do so.
The earnings that comes from the Save 1 Million Life has significantly contributed to us increasing or improving on the quality of services within the health sector. Because just like I told you earlier on, it was from the earnings that we got from the DLIs, from the Save 1 Million Life, that we're able to use part of it for the renovation. Yes, the contract has been awarded and to different individuals, and just like I told you, different individuals with different quality. But as an agency, we try to see how we control the quality of work that will be done at the primary health care, so that at the end of the day, everybody, every community has a cause to rejoice and appreciate His Excellency Engineer Yesuli for that wonderful contribution. Talking about the level of work that has been done by the Save 1 Million Life, yes, the equipment, I think they had procured more than 80% of the equipment that is needed by primary health care based on the work plan that they did, because the resources is thin, but we have to prioritize our needs. Then talking about this, the infrastructural work, yes, I told you some contractors have completed their jobs and some are still, the work is still ongoing. Yes, relatively, I won't say 100%, but we are satisfied with some work that has been done so far.
And actually, Saving 1 Million Life is one of the programs that bring a lot of impact into this facility or the whole state at large. Because as you can see, if you observe this facility, there's a lot of tremendous achievement recorded in this facility based on the renovation that they did. And actually, we really want to recommend them, because it's not all the facility that is being selected for this program, but we are opportune to be part of this program, and this program has filled a lot of vacuum to ensure that all service delivery is rendered within the facility and the community as a whole. The intervention of this SOMI is something that I'm highly impressed on their effort, because if you consider my previous record in this facility, based on their renovation, you discover that my facility has turned to a kind of a general hospital, not only primary health care, because of the quality of the program that they have brought in this facility. And they did well. As you can see, based on the intervention of this SOMI, you discover that the number of clients in the facility has improved, unlike before their renovation.
I feel very happy that the government, through Save 1 Million Lives, are able to take the right step in renovating this facility, making it to become a new one. And at least people appreciate seeing government hands into a facility where they can always come for their services at all time. The level of work now, the renovation they did is far better off than the previous ones. Although MDG was here, they erected the other structure, so which means they did a lot. But over the years, it has dilapidated, but now it's back just like a new one. I wish to appreciate the effort of the state government, His Excellency Engineer A.A. Sule, over the initiative of bringing Save 1 Million Lives to this our very community to renovate the existing structure and to put it in shape for better services and service delivery to our communities.
Actually, we are grateful. They've actually transformed the facility, especially in the aspect of electricity, light supply. We were really having issues using generator, which breaks down time in and time out. We used to do our repairs and so on and so forth. But now we have adequate lights. And the facility, the look, everything, you wouldn't believe that it's a village facility. And people are really happy being here. The patients, they are comfortable. And the community is grateful. We, the staff, are very grateful to the Save 1 Million Lives and to the government of Nasarawa State. We really appreciate their efforts because we are really lucky to have been chosen to have our facility renovated.
Asibiti kan ba ce komi yanzu ka an samu canji ba kadan ba kan gaskiya wallahi samu canji bisa dari da goya kayake da bagashi wannan da kaya ba ni zama ba ni kwanciya amma yanzu wallahi in ka zuma wallahi yabo ya mina sai ba kadan ba ba ni da bin da zai ce Allah ya kara ka dun goyuwa Allah ya sa wannan asibiti Allah ya kara miki da koka.
Thanking them for the good work they are doing here. I'm praying that God should help them for their work, to do their work.
Gyara ɗaya kuna ma sun gyara mana ɗaya kuna sun fiye da nada. Sosai suna kan gyara. Muna samun magunguna mai kyau.
The project in Nasarawa State has two objectives. While one is to ensure that health indices are improved in terms of quantity, the other is to ensure that quality of service at the various healthcare centers are improved, particularly as it affects women and children. To achieve that feat, SOML has invested in human capital development by way of building the capacity of healthcare workers in different fields to address challenges in the 6 thematic areas of intervention.
There are trainings like under immunization. Capacities of healthcare workers are built in such a way that they can carry out immunization services effectively, and the quality is guaranteed at health facilities, and even go for outreaches as well. This is to ensure that children are fully immunized against killer diseases.
As the name implies, we had SERIC, State Emergency Routine Immunization Coordination Center. We are developing a work plan, a workable work plan that we are going to conduct activity for the year 2021. And we are aware, if you didn't have a work plan, you don't expect to carry out any activities. And the activities encompasses what activity related to routine immunization and primary healthcare systems in general. And so they've actually supported the routine immunization in Nasarawa State. Through supporting routine immunization, supporting supervision, we're conducting to assess to see how session is being conducted using the method of ORI strategy, and also, as you can see, they are the same SOML that is sponsoring the work plan we are developing for 2021 now.
The contribution of Saving 1 Million Life is very key because it is Saving 1 Million that all brought us here, the funding and bringing all the technical people to guide in ensuring that we have a robust work plan.
The Saving 1 Million Life have really pushed most of the program that is conducted at the state and at the LGL level, particularly on the routine immunization and other services that is carried out in the state. We really appreciate them.
We also have trainings skill-based attendant training, like the modified life-saving skills. We have long-acting reversible contraceptive, that's LAC training under family planning for healthcare workers. We also have training on NAMAT for HIV testing services, which are also done to healthcare workers, especially those facilities that are activated by the program. Because the program activated most of the sites, ANC sites that are not carrying out HIV testing. So this has been done by the program effectively, and they are being supervised, as well as their capacity are built towards qualitative service delivery.
First of all, we have to identify those facilities that are offering ANC but are not offering HTS services. So we have to identify them and then activate the site in all the local government in Nasarawa State. So currently we can say that we are at the level of like 80 to 90% of health facilities in Nasarawa State are offering HTS in ANC with the effort of Saving 1 Million Life program for result in Nasarawa State. So in this regard, we make provisions of commodities that will be used for that purpose, such as the HIV test kits. Consumables are also provided as well, and then this are given to every facility that is skilled up in terms of HCS. And then there are trainings for health care workers. That's NIMA training is also included, which is also done to healthcare workers at primary healthcare level.
Saving 1 million life, to be sincere, they have supported the state in so many ways, especially in childbirth spacing. They supported us in buying consumables and commodities to the facility, and we are supported to go for supportive supervision to the facility we train. They also supported us to train almost 320-something health workers. They have seriously helped to make childbirth spacing effective and easier for women of childbearing age in Nasarawa State. Their contribution is very effective and successful in Nasarawa State, because from their support we were able to see so many women accessing childbirth spacing now in Nasarawa State, and all our health facilities now have trained personnel that you can walk in and they will be able to offer the services. So we want to appreciate Saving 1 Million Life for their contribution to the state and for making life easier for women of childbearing age in Nasarawa State.
Having here today is a workshop that will definitely impact positively in the health sector to reduce the maternal and the perinatal deaths. You know, Nasarawa State has a very, very high maternal mortality, for about 800 per 100,000, and nationally it is 500. So you can see that the maternal rate in Nasarawa State is far higher than even the national. And with this training, where all the general hospitals, the doctors, the nurses, and the health information officers are being trained, definitely there will be a very, very great impact in service delivery and in the reduction in the death of pregnant women and children.
And also we look at community volunteers. The program engage them to ensure that LLIN are being used appropriately, because the program measure the ownership and utilization of LLIN by household. So for us to ensure that the LLIN that are received by women and children are being used properly, so these community volunteers move from house to house to ensure that they ask them certain questions using the checklist that is being provided by the program to ensure that they are used. So in that regard, the program have provision or made provisions on training such, and also the health workers that will supervise the same activity in every local government. Then we also look at the community itself.
So Saving 1 Million Life have procured a quite number of nets for the community, and then this net is used especially for children under 5 and pregnant women, and also children under 5 when they complete their immunization. They are also entitled to nets. So not just about net, we also leverage on that process to ensure that if there are people at the house that are having fever for more than 24 hours, we encourage them to go to the health facility to seek care, which we have 515 health facilities that are supported with malaria commodities in the states. I would like to thank the Saving 1 Million Life because it has come to our aid. We so much depend on partners to do this, to do that. So where there are gaps, at least Saving 1 Million Life have come in to fill those gaps that we don't completely depend on partners. So I would like to thank the state government for that effort.
Logistic management information as well as monitoring and evaluation officers have also benefited from the capacity building aimed at improving quality healthcare service delivery in the state.
The Saving 1 Million Life supported the HMIS, that is the Health Management Information System, through the procurement of phones, 200 mobile phones to be distributed to the facilities. Now, not just purchasing these phones, there was also training for these 200 facilities on how to use the phones to report their data direct from the facilities instead of sending their report to the local government. Because if you look at our health facilities in Nasarawa State, some are very far. They are not close to the local government. So it takes them time to come to the local government to submit those reports, and at that time it will be late. So they sent the report direct to the platform that every data is supposed to be sent to. Save 1 Million Lives have done to make it very easier for some of those facilities in the rural area to report. Now, the second thing is training. The national, which is the Federal Ministry of Health, has released a tool that is used in capturing data in our health facilities. And this tool is called the Health Management Information System tool. We were formerly using version 2013 and we start using version 2019. But there were no money to train our private facilities so that they can be able to use those tools. So what the Save 1 Million Life program did was to support the system in training those private facilities, about 300 of them, so that they can also be using that tools to report. Who get their data, that is administrative data, every month will get their data in the facility. Not just in the facility, you sit down here in your office and see what those facilities are doing. It is an achievement that has not happened in the state before, but the Save 1 Million Life program was able to do it for the state. We spent more than 5 million in those training. They also supported in training of the ward focal person. Now, all over the country, no state has ever trained ward focal person on data collection using the NHMIS tools. Nasarawa State is the first state to do that. Not just doing that, we invited people from Federal Ministry of Health to be part of the training to see what Nasarawa State is doing. And they were very happy that Nasarawa State started this and they are going to roll it over to other states. 147 ward, the whole ward focal persons were trained on how to use those tools. They also procure laptops, about 38 laptops for all the local government MI officers so that they can use it in capturing their monthly report. Now, after the rollout of version 2019 NHMIS tools, the state, and if you look at the budget, the state budget, there's no budget for printing of HMIS tools. But with the coming of Save 1 Million Life, we were able to print 3,800 HMIS tools and distributed to the facilities in Nasarawa State, both private and public. And we spent almost about 8 million in printing those tools. So they have impacted a lot in Nasarawa State. Not just This one I'm saying now is just for my own area, my own unit, which is the Health Information Management System unit. There are other things that they have done for other programs, but this one is just for my program. I am happy that the program came, and I am sad that the program is going, because they impacted a lot on us. My word of appreciation is I'm thanking the Federal Ministry of Health for initiating this program.
Equally, the program has committed a lot of resources to ensure that mother-to-child transmission of HIV/AIDS is reduced to the barest minimum in Nasarawa State.
The Saving 1 Million Life has actually done tremendously well in the HIV intervention in the state. And I will tell you, like this healthcare worker and this set of people that we brought them on board, so if you finish training these people, we will have over 600 healthcare workers from rural communities working in various PAC. And so, using the Saving 1 Million Life alone, by the end of Saturday, we will have trained over 600 from the beginning of the Saving 1 Million Life to today. And also the same Saving 1 Million Life, it also helps us to actually go and provide what we call the mentorship and supportive supervision to this healthcare worker that we've trained them, and other one that are even working in secondary and tertiary facilities. So it is actually their support, and then the state is actually beginning to actually own the program. We are urging that even at the end of this, so Saving 1 Million Life, we believe the government will also still support and see how this program is carried on.
To increase access to primary health care centers, hospital equipment worth millions of naira were purchased and distributed to some primary, secondary and tertiary health care centers across the state.
So example of such equipment that were procured under primary health care, like delivery bed, hospital bed, couches, ward screens, labor room items like the ambu bag, generally resuscitation kits, and baby cots, weighing scales, both baby weighing scale, adult weighing scales, and we have BP apparatus, among other equipment.
What we have done today is the second phase of the distribution, because all the general hospitals in the state, we have 17 of them spread across the local government areas, have received their own. Today, the primary healthcare clinics that we have, almost 770 something of them are in the state. And most of these things will be going to them this afternoon.
We also have some equipment that were procured for the secondary healthcare level. About 5 of the general hospital benefited from 4D scanners, which are distributed to the general hospitals, 5 of the general hospitals. About 5 microscopes were procured and then given to the TB program to enhance their work. And all these are done towards qualitative service delivery in the state, particularly towards children and women.
Oh, we are so excited. We're very grateful to the government of SOML and the Save 1 Million Life for this wonderful donation. These are 4D scanners, expensive and very qualitative equipment that we contribute in no small way to improve the healthcare services with the deployment of this equipment.
So I'm very happy that it has come at such a time, because we have challenges in the fields where some of these microscopes that we have in our fields, some of them are already bad. Some facilities don't even have. So with this number of microscopes, we're able to identify facilities, laboratories that will need them for diagnosis of TB. And with that, I believe that with time, our cases in the states for TB will increase, because without that, you cannot ascertain how much or how many of such patients that we have in the state.
SOML has equally purchased commodities and consumables such as vitamin A and deworming tablets in demonstration of its support to Maternal and New Child Health Week in the state.
The objective of the program, if you look at it, without putting all the mechanism in place, it will be very difficult for the program to achieve its stated objective and at long run to achieve the goal. of reduction of maternal mortality rate in Nasarawa State. So in the quest to do that, we have to consider not only buying the equipment, not only building the capacity. By the time the capacity are built, of healthcare workers are built, basic equipment are available, but then the drugs and consumables are not available. It means that we can't really achieve our goals. So they all work hand in hand. So the program have also put effort or consider in its work plan procurement of consumables, hospital consumables and commodities such as the vitamin A supplementation, deworming tablets, anti-malaria and others. That has been procured by the program and distributed to health facilities. And again, the consumables that needed to be used for family planning for HTS services were also procured as well. Not only procuring such, we have to ensure that alongside those family planning commodities that are procured are taken to the health facilities directly. That we use a push system of logistics management. So these commodities, consumables were pushed directly to the health facilities, not the local government. We are delivered directly at every benefiting health facilities.
Saving 1 million lives has greatly impacted on nutrition. As in, I think the thematic area for nutrition is actually vitamin A supplementation, which under the umbrella of the Saving 1 million lives, for now we have been able to achieve almost 97% coverage for children. In 2016 through 2017, we were actually at 46%, and then by 2018 we were able to reach almost 78%. But last year, that is 2020, we were able to reach 97%, which is actually a great score for us, because for that it has even brought us the limelight of other international organizations who have hailed and have also pledged their continuous support for the state. And the Saving 1 million lives, even though it is the thematic area, like I said, is vitamin A, has not only restricted the services to only vitamin A. It has expanded widely to other diverse areas of nutrition, such as the infant and young child feeding practices. We have been able to train health workers and community volunteers to support communities in the child feeding programs. And of recent, it has also delved into the area of community management of acute malnutrition by actually supporting the program with a whooping sum of almost 20 million naira to buy the ready-to-use therapeutic food, which is the actual supplement for the therapeutic program. As expensive as it is, Saving 1 million lives actually came through for us, and we'll continue to sincerely appreciate what the Saving 1 million lives is doing for nutrition. And I think you see that under the umbrella of the Saving 1 million lives, we have been able to so far scale up IYCF to about 3 LGAs, and then very importantly for us, we have been able to cover all the wards, and we still see better times coming, because we're still expecting more from them. And then likewise, I think because we still have almost half the LGM wards and other LGAs to cover up, and we feel and we know, and we'll continue to hope that Saving 1 million lives will always come through for nutrition, as it has come through for all the other thematic areas.
The Saving 1 million lives is targeting 6 thematic areas. One of those areas is malaria, that's provision of long-lasting insecticide-treated bed nets. Another one is elimination of mother-to-child transmission of HIV. Those two are squarely domiciled in the public health department. Other interventions include family planning, that's improvement of the modern contraceptive prevalence rates, immunization, emphasis on penta 3 coverage, and of course nutrition. Now, if you look at all these 6 thematic areas I've mentioned, there are areas where we have huge challenges before the advent of saving 1 million lives. Now, let me start with malaria. Before the intervention came in, we had 60 to 70% of all hospital admission, and about 60 to 70% also of outpatient consultation being attributed or linked to malaria. And we've put in different strategies to ensure that we're able to reduce this burden of malaria in the state. We'll move from there to about 30%. But as I speak to you today, the prevalence of or the burden of malaria in Nasarawa State, according to the NDHS 2018, is 14%. And it is because we've been able to, in addition to other intervention in the state, utilize the SOML intervention to distribute as much long-lasting sexually treated bed nets to women and children, pregnant women, and of course children less than 5 years in the state, so that they sleep under these nets and reduce the prevalence of malaria. Now, with regards to elimination of mother-to-child transmission, now the maximum is that if 100 women attend antenatal, those 100 women should all be counseled and tested for HIV and screened for HIV, and those that are positive should be linked directly to care. Now, in the last NIH survey we have in the states, I showed that the prevalence of HIV in the states is about 2%. So if 100 women attend antenatal, you expect that 2 of them will have HIV. And we expect that those 2 should be immediately linked to care, because if they are not linked to care, those mothers will transmit the HIV to their unborn babies. But if they are promptly linked to care, then we'll be able to reduce the transmission of the rate of transmission of HIV from mothers to children. And the SOML, 71 Million Life program, has helped us in that way, because right now, as I speak to you, we have almost saturated the entire state with healthcare workers that have the knowledge and skill to be able to provide these services. They will counsel these women, they will screen these women, and they will test these women. And so, in addition to what the state already is doing in the HIV space in terms of provision of commodities, SOML has helped to train, build the capacities of our healthcare workers all over the state, from primary, secondary, and tertiary health facilities, to be able to provide this service. Now, when it comes to family planning, the same kind of intervention. Family planning is an intervention that reduces maternal mortality rate by about 30%. And we know that our contraceptive prevalence is about 14%. What we're desirous of is raised to about 27% according to the national guideline. And SOML has also helped in that wise in 2 ways. First, in building capacity of our healthcare workers to be able to provide services for these women, and then also in procurement of commodities. There was one time in this country that the entire nation, there were no family planning commodities were not procured. Nasarawa State was one of the few states that was able to get commodity because it leveraged on the existence of the Saving 1 Million Lives program to procure those commodities, and our women were getting services. If you go to the immunization space, and the pentathree rates, in fact, is one of the best now we can boast of in the country, and also in the nutritional space. So with all these interventions, we'll be able to prevent needless deaths by our mothers, needless death by our children that are less than 5 years, improve their quality of life, and of course reduce the burden of these diseases that were hitherto ravaging the people of Nasarawa State. And also to state that beyond these ones I've mentioned, the Saving 1 Million Life have also helped us in the public health department by intervening in the area of tuberculosis, where we're able to diagnose children with TB and provide care for them, which is also very key to us. So I think we have utilized maximally the opportunities of the SOML in the country and in the state, and we can only go up from here, because we now have a pedestal that has raised us, that have been raised, and we'll struggle to maintain that pedestal and ensure that we continue to improve the quality of lives of women and children.
As part of efforts to strengthening healthcare deliveries in Nasarawa State, particularly for those at the grassroots, especially the indigent, that is the poor of the poorest, to have access to healthcare deliveries, the State Ministry of Health, in collaboration with Saving 1 Million Life, have organized this free medical outreach to ensure that interventions went down to the grassroots for the common man. Those who doesn't have hope should be able to have hope, and also to reduce the out-of-pocket spending, whereby some of them are not able to pay for their hospital bill. This intervention have helped in times of free surgical cases, and then other treatment of disease conditions were treated free at no cost. And then the program also ensured that there are availability of drugs and commodities that will be given to patients that are seen. And even in terms of lab investigation, ultrasound scannings were also equally done free of charge to every patient that were seen at the hospital at the course of this intervention in Doma LGA. And it is our desire that the program will support this process in the 13 LGA in Nasarawa State.
My name is Dr. Mohamed Ali Ozega, consultant obstetrician and gynecologist from the Atuharos Specialist Hospital Lafia. I am the chairman of the outreach committee. Overall, the outreach has been extremely successful in relieving the sufferings of the downtrodden that are truly sick but cannot afford the cost of medical services. As we all know, a lot of our medical spendings are out of pocket. So a lot of people that are sick cannot afford to seek for medical care. We did a total of 27 operations, including one emergency cesarean section where we gave birth to twins. And the woman is doing well. We have done surgeries ranging from hydrocelectomy, hyoneoplasty, lipomectomy, and all sorts of surgeries. Today we have a total of 47 patients booked for surgery. Already, as at the last count, we have done like 15. It is still counting, and we have already seen about 300 medical cases. We have booked about 600 of them to be seen. And all the patients that are seen, including those that have had surgeries, they are given drugs free of charge. We also have a consultant radiologist who does ultrasound scanning. So all our patients that need ultrasound scan, we have a consultant radiologist that will scan them. And then the results will be taken back to the doctors for review. Overall, the program has been very, very successful. I also wish to thank SOML for shouldering the responsibility of financing this program. Without their help, it wouldn't have been possible to shoulder the responsibility of financing this program.
My name is Dr. Gonji Thomas, Medical Superintendent in charge of Akwanga General Hospital. We've been able to do up to 41 operations as I'm talking to you now. Though there's still a lot of them around, and we're still going to continue with them till down. We're expecting close to 70 people to be operated again. So I think most of the logistics have been met. We have enough drugs, consumables, enough surgeons are available, and the medical officers seeing the patients are enough.
My name is Pharmacist Luca Augustine. Well, we started this program 6 years today. It has been very, very, very great. As you can see, the multitude here. Since yesterday, people are coming from different locations to access free treatment. We want to say that the state government has done a very good thing here. At least the people from the grassroots are feeling the impacts of this present administration.
Now that the project lifespan is coming to an end, what are the plans to sustain the laudable achievements recorded for the benefit of the good people of Nasarawa State?
You know, what we normally have is we work with our annual work plan. So since the program is targeted to end by the end of 2020, in the 2019 work plan, we included funding for activities of Nasarawa State Health Insurance Scheme for the full takeoff of social health insurance scheme in Nasarawa State, which has to do with our target group or the most vulnerable group, which are the women and children, especially the pregnant women and children under the age of 5. And also, as part of the sustainability plan too, the stakeholders met and then agreed upon, and the coming of the basic healthcare provision fund is also one of the sustainability plan of saving 1 million lives in Nasarawa State, in such a way that all the programs that have done or they are supposed to be doing routinely will not suffer.
With the coming of basic healthcare provisional fund, in which they are going to support the vulnerables, because some will also come they don't have, those that had an accident that cannot afford, and those who came unconscious that you don't know who they are coming for. How did they get it? All these are supportive, in which the state government has made the fund. The federal government has also provided a fund for us to take care of those people when they come, and when the system come in place, they'll be cared for. There are two windows to see circumstances. One, the public assessment, and the private individual assessment, both in organizations or on individual and private basis. And all these are available for you to take into Nasarawa State Insurance Scheme for the benefit of all. And as you do know, insurance, health does not knock on your door that e-health is coming. And more so, it's a pool that sometimes you might contribute for the next 5 years. You might not even need it. But for those vulnerable and those who are most exposed to illness, you'll be touching their life, and God will touch us. And the reward from God will also touch you. Because by not knowing them in person, that contribution that have saved a life in several ways, you have your reward forthcoming. And the more healthier all of us will become. So the best way for us is to key in, because we don't know what goes around comes around. The time that these things will serve us, nobody can tell. But in the key interest of believing that one of Nasarawa State was an EDC, health insurance is the gateway.
The health insurance scheme has been introduced and is being piloted now. So we expect that most of the intervention that we see through the SOML will be able to also get it through the health insurance scheme. We are happy that there was SOML in the first place, and we're very happy with the intervention in the last couple of years, I think 5 years or so. We are not happy that it is going. However, it had a duration right from the time that it came, and that's why we're discussing sustainability, so that even after it leaves, some of this project will be able to be sustained by the hospital and by the state.
Indeed, the role of critical stakeholders in driving the project objectives on a sustainable basis cannot be overstretched.
I shall be the nation changing history.